Hello, everyone. I welcome you yet to another episode of Inside Health Africa. And as always, it's your host, Derek Katwe. And today we are going to discuss one of the biggest health challenges in Uganda, Africa, and the world at large. And that is cancer. To help us understand that better, we are joined by a specialist a doctor with us today, and that is Dr. Okello Mark Malcolm, who is a pathologist. For context, a pathologist is a doctor that specializes in investigating disease. So, Dr. Mark,
Yes,
you
please.
are very welcome.
Thank you. It's a pleasure.
Yes. Now, cancer, or what is commonly known as kokolo, is a big issue in this country. You know, we either know someone or a relative, has gone to the hospital and we've been told, the issue is cancer. And the notion is cancer is something that once it gets you is very expensive to treat, but also the treatment most of the times is a doubt. Help us understand, what is this cancer for our viewers?
Thank you so much, Derek. And to our viewers, you're welcome. And it's a pleasure to be able to share this information with you so that you can be able to take necessary precautions. To begin with, cancer, in very simple terms, means an abnormal growth within your body. Okay, so to just use it as an example, that sometimes the breasts, it could be a woman's breast or a man's breast, starts growing abnormally. And those tissue inside there can move and cause destruction to other parts of the body when they say the cancer has spread. So in very simple terms, cancer basically means an abnormal growth that has happened to part of your body. And this abnormal growth can happen in any part of a human body. It could be in your hands, it could be in the bones, it could be on the cervix of a woman, it could be on the throat, it could be on the breast, which is very common in our community. So yes, it's very important to understand that whenever you see an abnormal growth anywhere on your body, then it is very important that you first seek medical care from a recognized institution nearest to you.
As Inside Health Africa, we are committed to educating the people about issues that are most pressing in communities today. Dr. Mark, help us understand, what is the burden of this cancer in Uganda today?
All right, thank you. And Derek, I must say that's very important for our viewers to be able to appreciate why we should take necessary precaution and interest in our life in as far as cancer is concerned. As of 2022, which is very recent, there are normally registries that take into consideration how many people have been diagnosed with cancer, how many people are currently living with cancer, or how many people have died as a result of cancer. And I must say, the numbers are actually worrying. To begin with, it is estimated that we have about 35,000 people in Uganda who are living with the cancer. And out of the 35 every year diagnosed with cancer, we have almost 25,000 people dying as a result of cancer as well. And also to note that nearly we have about 80,000 people in total who are living with cancer in Uganda. When you look at these figures, these are very huge number, which means that you could be having a relative, a friend, a neighbor next to you could be having these diseases. And so that brings us to the perspective that once you see something abnormal, you do not have to wait any longer. It is very important to seek care, because as we can see, 80,000 people, it's a very huge number of population in our country.
Dr. Mark, when you shared the numbers, they sent chills down my spine. 80,000 Ugandans are living with cancer today. And did you just say that we are getting 35 new cases, 35,000 new cases every year?
That's correct. 35,000 new diagnoses of cancer add onto our population every year.
Wow.
And that we are losing about 25,000 of them every year. And this is purposely because we get very late presentation. We get people being diagnosed with cancer at a very late stage, which means with the cost and then the endurance of treatment, unfortunately, a substantial number of patients do not make it. However, there is good news to that when you notice out of the 35,000, not all are dying. So that means those who get to come early at the onset of disease get proper diagnosis, proper treatment, and even potential cure.
Now, the truth is there is a lot of information. Some of it true, some of it not true, some of it the people are not sure. But there's a lot of information in the population today. You find that in particular families, they'll tell you we do not use this kind of utensils anymore in this house. We do not do, there are particular practices that people have picked up along the way, and they're trying to run as fast as they can from this killer called cancer. Dr. Mark, help us understand what are the key contributing factors from you, the specialist, that people have now gotten to be aware of, and what they equally have got to do to make sure that cancer does not catch up with them.
That's a very important question, and it enables our viewers to be able to appreciate what they should look out for and what they should be able to appreciate. To begin with, there are multitudes, there are very many risks that come together that predisposes an individual to developing cancer. And one of the biggest risks is actually having some genes, some message in our body that makes us have a higher risk of developing cancer. And that's why we often, when we doctors are asking a patient, we ask you questions like, is there someone who in your family has ever been diagnosed with this cancer? Because we want to see how best can we protect anyone in your family not to get that same cancer again. So by you answering us, telling us maybe my aunt had ever been diagnosed with breast cancer, it enables us to know whether you have some genes. For example, in the breast gene, we call it BRCA gene, that sometimes predisposes these patients to developing this cancer. But having the genetic makeup is not adequate enough. There are certain things that we go through in our lives that increases on our risks further. For example, it's a known fact and scientifically proven that taking alcohol increases our risk of developing cancer, especially cancers of the throat. Smoking is another significant contributing risk to the development of cancer. Eating certain types of food that are overly processed can also predispose us to developing cancer, especially cancer of the stomach, cancers of the intestines, which we normally call colon cancer, are also associated to some of the food practices that we take in our community. There are also infections that actually increases on our risk of getting cancer. One of the significant increased risk is HIV. Getting HIV infection predisposes an individual to several cancer, and that's why it is very important that whichever individual has HIV infection, they should be in treatment to keep their immunity strong. This is very notable in women who have, the women who have HIV have very high risk of getting cervical cancer, and it is very known. So we normally encourage them to make sure that they get screened regularly to prevent that. But also there are some other infections we call HPV infection, which is actually the most initiating factor in developing of cervical cancer. So we get to notice that, for example, also acquiring hepatitis infection. Hepatitis B virus is an infection that affects the liver. And patients who have hepatitis B virus infection have a very high risk of subsequently undergoing complications that actually advances into cancer. Not all of them, but some will develop cancer of the liver. So we get to appreciate that there are these contributing factors that we should be able to watch out for. One is your lifestyle, making sure that your alcohol consumption is not very excessive, making sure you avoid smoking, ensuring that certain infections are prevented and you do not get to acquire them, and ensuring that we live a balanced, healthy meal diet, on top of which, very important, is actually being physically active and exercising regularly. Thank you.
Thank you so much, Dr. Mark, for talking to us about these contributing factors. Now you know what could potentially lead you to getting cancer. But Dr. Mark, in there you mentioned something that touched me. You spoke about alcohol consumption as being one of the things that predisposes someone to cancer. And as someone that, once in a while, with friends and whatnot, I am happy to have a bottle, two, maybe three. I mean, who is counting? And I know I'm not alone. Could you maybe, to just put our souls at ease, what would be the recommended amount of intake for alcohol? To just make sure that we are keeping happy. We need to be happy, doctor.
True.
And yet we are not, predisposing ourselves to getting this cancer.
So to make clarification in regards to what Derek had asked, it's very important, dear viewers, that we monitor the amount of alcohol we are consuming. First and foremost, I need to make this clear that there are instances where we are actually consuming alcohol out of excitement and irresponsibly. Now, having one drink per day is optimal enough according to the scientific world. Okay? But now if you find yourself, taking the entire bottle and you're literally drinking every day, weekends, it's not just about having an interaction or occasional meeting, then such a behavior predisposes you significantly to a risk of getting cancer of the throat. And also the type of alcohol we drink. For example, we understand that some of the alcohols that are in our community are very impure. They have so many contaminants because they are brewed locally and so on. But when we are drinking also alcohol that have minimal impurities, and they are a bit safe for your health, but also in a very small amount, then that one is okay. But not drinking alcohol every day that you even tend to forget that it is time to go back home.
Thank you so much, Dr. Mark, for clearing the air on that. Now that we do understand what factors could potentially predispose someone to getting cancer, increasing the risk of getting this cancer. You've just told us in the statistics that we have over 25,000 people are dying from cancer every year. How crucial is early diagnosis in bringing that number down?
It's very brilliant that we are actually able to provide this information to our viewers so that they can be able to appreciate that early diagnosis is very, very crucial. In fact, when we just go to the crude numbers, we are diagnosing 35,000 every year with cancer of various types. And we are registering up to about 25,000 deaths directly linked to cancer every year. That means proportionately, we are able to save about 10,000 people. And this number, we can actually improve it further. Key factor and significant is that the patients have to come to hospital very early. Now, we always underscore the significance that we have to have regular health checks. We recommend yearly medical checks for adults. Okay? It is supposed to be like a part of a New Year resolution, making sure you understand your body. Go to your doctor, they check you very well. Now, this enables the doctors to know if there is a small deviation in your body. But also there are practices that we encourage. For example, we encourage women, our sisters, mothers, to make sure that they're examining their breasts every time they're going to bathe, to take a bath, so that they get to appreciate if there is any swelling that has started. As small as it is, it should not be ignored. Immediately, you seek care. Whenever you see any growth or change in the color of your skin or swelling that has happened on any part of your body, that is the very instant that you seek help from a medical expert. So when we get to diagnose this disease early, we can stage them very well. We do additional tests, for example, like scans that are appropriate, and then we guide oncologists, which are doctors specialized in treating cancer, on what ways forward. So when you come in early and your doctor notices the swelling and it is taken and brought to us in the pathology lab, we are able to process this as swelling that your doctor submitted to us, and then we report to this doctor that this is the type of cancer that this patient is having. Then with additional examination, additional tests, this patient gets staged, and if it's early stage, you might find that even just surgical removal of everything around there is good enough to cure this patient. But if it has advanced, then that means there are additional treatment that has to be undertaken in consultation with the oncologist. But key factor is that when these diseases are diagnosed very early and staged very early, patients have a very increased and a very high chance of making it alive.
So, Dr. Okello, thank you for all the information thus far. But just for clarity purposes, when I realize that I have a swelling, walk me through the journey of what it's going to be like, and how easy or difficult my access to care is likely to be.
Okay. I thank you once more. And this is very important to our viewers and to the population who are going to be able to access our information today. That Uganda has a system of healthcare from a village level up to the national referral level. So we have doctors, medical officers at health center force and district hospitals, regional referrals, and national referrals. Now, also we have private medical facilities that have doctors. Now, and I want to be very clear on this. As a patient, once you have noted that you're having a change in your body, and I want to make this clear. By change, I mean, is it a swelling on any part of your body that used not to be there? Is there a color change? You used to be a person who is having dark skin like me, but now you're seeing something more darker coming up on an area. It is a point where you have to make a visit to the nearest facility that has a medical officer or a doctor. Now, these facilities can be government health facilities at level of health center force, or district hospitals, or regional referrals. And then you can as well be able to access some of the private medical facilities, those that have doctors who can be able to understand what disease progression is about. These doctors will discuss with you options on how to ensure that you get your results. Part of it is that they will be able to take off a small piece of this swelling, which we normally term as biopsy. That this piece will now be transported to the pathologist lab, and then we shall examine this piece of tissue that have been removed from your body. We will provide report in the shortest time possible to the primary doctor, and then you can be able to access your report from your primary doctor. So even when you are at Moroto, or you are in Bundibuji, or you're in Kampala, or in Arua, you do not need to move up to Kampala to get these services. As long as you are able to access the nearest medical facility which has a doctor, from health center for district hospitals, regional referral hospitals, they can be able to pick off a biopsy sample, bring it to us, the pathologist. We shall examine it and then bring the report back to your doctor, and you can pick it at your convenience. This, I believe, is quite an accessible services in our country. However, there could be challenges in here and there, but it's very accessible to get your cancer diagnosed in as soon as possible.
Thank you so much, Dr. Okello, Mark Malcolm, and see you all on the next episode here at Inside Health Africa.